British Prime Minister is warning that hospitals will face considerable pressure in the coming weeks as cases of Omicron surge across the country. Some hospitals have seen critical staff shortages due to the outbreak. Boris Johnson has largely resisted imposing new restrictions despite warnings by senior health officials. But he has announced that older children will be required to wear face masks when they return to school later this week. Infection rates have surged, with more than 137,000 cases recorded on Sunday.
Omicron is much milder, considerably milder than previous variants, and we're much more boosted. So our position is far, far better. But looking at, I think this is what I would say to everybody, looking at the pressures on the NHS in the next couple of weeks, and maybe longer, looking at the numbers of people who are going to be going into hospital, it would be absolute folly to say that this thing is all over now by the shouting. We've got to remain cautious. We've got to stick with Plan B. We've got to get boosted.
Well, for more on the situation in the UK, let's head to London to speak to our reporter Victoria Smith. Victoria, how big of a crisis is this for the NHS and the overall healthcare system?
Evening, Roo. Well, we've got 12,000 patients in England at the moment in hospital with COVID. That sounds like a large figure, but as the Prime Minister said, that is not as large as this time last year. So that isn't the issue. What is the issue, Roo, is the staff shortages. We now have 7 hospital trusts across the UK who've declared a critical incident, with the latest being the Lincolnshire Hospital Trust. That means we can expect in the new year up to some 25% of staff being absent from their jobs, and that of course will cause a domino effect on treating those who are ill. Combined with this, we're hearing that more of the over 50s are now contracting Omicron, and of course the older people get, the more care they're likely to require. The government is looking at ways of helping out, doing what it can perhaps to move patients, to move staff to the areas most affected, because different areas of the country have different levels at the moment. Some evidence, in fact, that the capital, London, cases may have peaked, but that's certainly not the issue with the rest of the country, where cases continue to rise. In the meantime, we're being told to stick to Plan B for the time being, and we're also hearing about these hospital hubs that the government is planning to build. But of course, the problem there is you can't have hospital hubs, extra beds, without extra staff. And those hubs, such as the Nightingale Hospital, will rely on the existing NHS staff. And of course, we have a crisis in staffing numbers that's likely to continue for some weeks, if not months yet.
What's the potential for further restrictions given the impact of the surge of cases, especially on essential services and the impact of that?
Yeah, well, no change in terms of Plan B. We're being told to stick to what we were told before Christmas. That's to work from home where possible, to wear masks in public spaces. That's due to be reviewed at the end of the month to see if it's going to be extended, which looks likely at the moment. One change is the introduction of masks at secondary schools, at high schools. We've had masks there for a while, but now students are being told to wear their masks in the classroom. That's a change, obviously, intended to stop the spread among secondary school-aged children and their parents, relatives, grandparents, etc. So that is one change. We're also hearing that businesses in general are told to expect staff absences across the board, NHS and elsewhere, with absences of up to 25%, which is a critical level, which could, I suppose, impact on the economy too. So that is one to watch as people start to go back to work following the new year. And all of this, of course, while Scotland has seen a record number of cases. We've got 20,000 cases of Omicron, of COVID there now. So the message very much is continue to get boosted, to get those 3 injections, and we wait to see what happens when people return to school and work, to see if there'll be any more restrictions introduced by the government.